now being recorded.
And this meeting is now being recorded. So welcome, everybody. Our goal today is to provide you with some practical, needed information to help you manage the impact of the coronavirus on your organization. Please know that the Goering Center and trusted partners like Graydon Law and HR Elements are here to help you navigate these unusual times. Today, we're going to hear from Lee Geiger. He is a partner at the Graydon Law Firm and head of the firm's Labor and Employment Department. Hello, Lee. Give everybody a little wave there. As well as Tina Taylor, founder and CEO of HR Elements. HR Elements is a consultancy providing HR advisory services to private businesses and nonprofits throughout the Ohio Valley. Say hello, Tina.
Hello.
Okay. So both Lee and Tina have been on the front lines of the coronavirus issue, helping employers virtually nonstop for the last 3 weeks. We want to get going here, but before we do, I have just a few housekeeping issues for all of us. We want to acknowledge our sponsors. Plant Moran, Truist, and Haran are sponsoring this webcast today, and their support, along with the expertise of trusted volunteers like Tina and Lee, enable us to provide this information to our members and the general public at absolutely no cost to you. So we're going to turn it over to Lee in just a minute. Tina's going to chime in throughout, and then she'll have some time at the end. But I want to make you know that while the webcast is being recorded, you are welcome to share it with absolutely anybody who you think needs this information. There's a resource page on the Goering Center website where a link to the recording will be posted. And if you registered for today's event, you will get the recording link as well as the slides in your email following the conclusion of our broadcast today. So as you probably figured out, we've muted all lines to eliminate background noise. However, the point of today's program is we really want to hear from you. So in the lower left corner, you'll see a chat box. I'll be monitoring the questions as they come in. So please, as you have questions, type them in there. If it's timely to what the presenters are talking about, I will interject. If not, we'll have Q&A at the end where they address everything that's on your mind. Let's see, any other things? The presentation will be sent out at the end of today's program, and there's lots of information to cover. So I'm going to go ahead and turn it over to Mr. Lee Geiger. Lee, go ahead.
All right, thank you very much, Lisa. Appreciate it. Thanks to everyone at the Goering Center. It's always a pleasure and an honor to do any type of presentation with the Goering Center. Thanks to everyone who has logged in today. It has been a whirlwind. The last 2 weeks feel like it has been the last 2 years. I sometimes have to remind myself that when I don't know the answer or whatever, these laws have only been in effect actually less than 2 weeks at this point, and it has just been a wild one for employment lawyers, for HR consultants, for accountants, and for all of you as business owners. And it's not been easy for anyone, but we're muddling through it. Handful of just housekeeping things at my end. We have a lot of clients on the line, and I really appreciate all the clients that have logged in. Graydon's got a lot of awesome clients, but nothing that we're talking about today is protected by the attorney-client privilege. Everything here is it's just a bunch of people talking is really what it comes down to. Last two things. One, excuse the background here. I come to you from the penthouse suite corner office, which, as you can tell, is a card table in the corner of our bedroom. So, we all have glamorous offices these days. The last thing I'll say is my children are eternally grateful that this is a video cast and not just audio, because up until this morning, I had a beard of sorts, I guess, and my teenage children were embarrassed beyond belief. They're grateful that I did not go out in public looking like that. So here we are. All right, first thing I want to talk about, and I forgot to even put a slide on this, essential businesses. If you are an essential business, and under Governor DeWine's orders and also Governor Beshear over in Kentucky, under those orders, a lot of companies are deemed essential businesses. So if you fall into that realm, you should make sure that your employees all have letters that they keep in their car that say, my name is John Smith, I work at XYZ company, this company is an essential business, and here's why. That's going to be critical in case they get pulled over by, that is happening in some states. I know in Pennsylvania, they are stopping cars that are driving on the roads. And I know that in Butler County, we've had some clients that have gotten emails from the Butler County Health Department saying, you know, please explain to us why you are considered an essential business. We're only going to see more of that as things progress. So if you don't have those letters, talk to your employment attorney, and they will be able to get you something that you can use. Hey, Lisa, I think there's a line open. Tom Kirkpatrick's line is open. Could you mute that one? Thank you. So let's get moving on to what should we do if you have an infected employee, and we're just going to cover this and a whole lot of stuff very briefly. If you have questions afterwards, you're welcome to give me a call or call your employment counsel for that. That's the second of about 8,000 shameless plugs that I'm going to have for talking to your employment counsel, whoever that happens to be. These are just crazy times, and it's good to have some guidance. If for no other reason than that, whoever you're working with is probably working with tens or hundreds of other clients, and we've done a whole lot of, well, what's everybody else doing? It's good to know what other businesses are doing so that everybody's kind of following the same path. So if you get an employee that is infected with the coronavirus, the first thing you're going to do is send that individual home, or ideally they called you before they even came into work. You're not going to allow them to work. This does not mean, though, that you need to shut down your business. Just because you have an infected employee, you can keep operating your business. What you should do is tell other employees that worked with the infected employee, hey, want to let you know, someone who works in your area has been infected. Please monitor yourself, and if you show any of the signs of having the coronavirus, then please let us know right away. You'll be sent home, or don't come into work, whatever the case may be, but we don't want to spread it further. Now, you're not going to disclose the name of the employee. You wouldn't have said it before, you're not going to say it now. Do not disclose the name of the employee. Is it, you know, there are a lot of people on the line laughing right now. They're saying, well, I don't need to say the name of the employee. Everybody already knows that it's Tom, or it's Harry, or it's Steve or Susie. Okay, well, that's fine, but let everybody else figure it out through the gossip mill, not because you disclose someone else's medical condition. Okay, so let's get into, and we're going to talk today mostly about the FFCRA, the Family First Coronavirus Relief Act, which has two components to it. We've got paid sick leave, and we have the Expanded Family Medical Leave Act stuff. So what employers are covered? Generally, all employers with fewer than 500 employees, with some exemption for employers under 50 employees. If you fall into the under 50 employees, talk to your employment counsel and see if you fit into one of those exemptions. Basically, they only apply if you are if you're in a situation where your business is going to go under if you have to comply with these laws. The laws have some great tax credits for wages that are paid to employees who are on leave. However, we're dealing with a lot of companies who are saying, yeah, the tax credit's great, but I need the money in my account the minute that I do payroll, and I can't meet payroll right now. So that's an issue. So some of the complicators are combined companies that have 500 employees. So maybe you have two businesses under the same umbrella, and one has 300 employees and the other has 250 employees. So the question is, do you combine at 550, or are they two separate entities? And the answer to that is it depends, which is the lawyer wiggle answer for just about every question that's out there these days. It really depends on a lot of different factors in the integration of the business. The Family Medical Leave Act has an entire test to determine the integration level of the business, to determine whether or not you have the requisite number of employees. You need to go through that test. before you decide for sure whether you're over or under 500 employees. So the second one is, what about a company that had 500 employees before layoffs, but after layoffs has less than 500? On Saturday, the Department of Labor released new guidance on that, and that has become clear that you take the measurement at the time that the employee requests leave. So you might, in some circumstances, you might be at 500 or 550, but then when you do a bunch of layoffs, you drop down to 495, and then someone asks for leave, you're a company with 495, you've got to provide the leave.
Hey, Lee, I'm going to interject right now with a question that came in from Peter Ellington.
Sure.
On that topic. So can you give an example of possible exemption for employers under 50? Does that mean some employees under 50 are not eligible?
It does mean that some employees are not eligible.
Sorry, employers.
Yeah, it means that employers don't have to pay employees. So it's actually so this is the new guidance that the Department of Labor just issued on Saturday. So if you see me scrambling around on my desk, my card table, I'm trying to pull that guidance. So we've got it basically comes down to whether or not it will jeopardize the viability of the small business as a going concern. And it is only going to apply to the child care provisions of the sick leave and the family medical leave. We'll talk about those here in just a second. So it's important to remember that we have, and if that person wants to follow up with me afterwards, I'm happy to talk through that. I just don't want to get too far into the weeds on that particular exemption. On the paid sick leave, so remember there are two laws here. The first one is the paid sick leave, and the second one is the emergency FMLA. So the paid sick leave is going to apply to all employers, regardless, all employers up to 500 employees. It does not have the 30-day requirement. So keep that in mind. It does not have the requirement. Someone can be working for you for 2 days, 3 days. They are going to be entitled to this paid sick leave if they have a qualifying reason. So they get up to 80 hours. It's prorated for part-time, full-time for employee illness or quarantines, and 2/3 pay for most other reasons. So let's talk through what that means. And this is hilarious because God has a sense of humor. My neighbor has decided that today, right now, is the time to cut the grass. So I apologize if you can hear a lawnmower in the background.
We can't really, don't worry about it.
Okay, perfect. So the reasons that someone would need paid sick leave, they fall into 6 categories. Okay, the first one is that they have been quarantined due to local, state, or federal order. Okay, that does not include the Governor DeWine shutting down so many businesses, restaurants, other things. The next thing is that the employee has tested positive or exhibits symptoms of the coronavirus. So think of it as the employee's got it or they think they have it, okay? The third one is the employee has been ordered to self-quarantine by a healthcare provider. Okay, so those are the top 3, right? And in those instances, because they have the illness themselves, they can get up to 80 hours of paid sick leave at 100% of their regular pay, up to a maximum of $511 per day, or $5,110 in the aggregate. Okay, so in that instance, that is what they get. They get up to 80 hours, and then that's it. The other reasons that employees could need paid sick leave would be that they are caring for another individual who needs paid, who has coronavirus issues. Okay, so it's not just your typical Family Medical Leave Act people. This is any individual. So think they could be caring for a parent, for a child, for a neighbor, for a friend. Those folks are going to be entitled to paid sick leave, but only at 2/3 of their pay. The other is that the employee is required to care for a child because the school is closed or daycare is closed. In that instance, they also only get 2/3 of their pay, up to a maximum of $200 per day or $2,000 in the aggregate. Okay. My suggestion for everybody on the call, we have a great blog post on this that's got a chart in it that has just been used by everyone, all of our clients anyway, for understanding this. It's also got pay codes that you can use for good ways to summarize how to pay your employees and code it so that you'll be eligible for these tax credits. It's a blog post written by Julie Pugh. So if you go to graydon.law, written by Julie Pugh on March 23rd. And in the materials that Lisa's going to circulate at the end, there are some helpful links. And if you scroll down to those, you'll be able to see that blog post is listed. Okay, so let's move on from the paid sick leave part and let's go to the FMLA, or the expanded Emergency Family Medical Leave Expansion Act. Okay, so this provides an additional 10 weeks of paid family leave at 2/3 of the employee's regular rate of pay, where the employee is unable to work only for a bona fide need for leave to care for a child whose school or child care provider is closed or unavailable for reasons related to COVID-19. Okay, so remember, first thing we've got is the paid sick leave. Second thing we've got is the emergency FMLA. You're not going to go to the FMLA part until you have first covered the paid sick leave at the front end. Okay, if someone is off of work because they have coronavirus or they have the symptoms of coronavirus or they're scared about the coronavirus, they do not get the FMLA. The only people that are getting the FMLA pay are the people that are home because of their kids. And that's a distinction that not a lot of people picked up on at the outset, but that's what the law is. And the IRS is not going to grant you the tax credits if you are providing pay for folks that are staying home because they're sick or they're afraid or what have you, only for these specific reasons. In addition, there are a lot of companies out there that over the last 2 weeks put in their own coronavirus policy that allows employees to get paid for paid sick leave. The IRS is going to look at that and say, wow, you're a super generous company. Thanks a lot for doing that for your people, but you don't get any tax credits for it. You get absolutely zero tax credit for that. So if you were one of those companies that put one of those plans into place, please send a message out to your employees today that says, dear employees, we love you. We think that you're great. Just want to let you know that starting tomorrow, the new family medical leave and paid sick leave programs go into place. Therefore, our other program that was a temporary program is ended effective on March 31st. Otherwise, you're going to be stuck paying your coronavirus program plus the new leave program, because the law is also very clear that the paid sick leave and FMLA leave is in addition to any plans that the company already has in place. So if you don't end your current plan, you're stuck, and you're going to end up paying 2 weeks on your own, 2 weeks that the government also reimburses you for, which is great, right? But at the end of the day, you need your people at work working. So if you didn't need them there, then you would have furloughed them or laid them off. Okay, so let's move on.
I just want to make you aware, we have about 6 questions that just flew through, and I don't want to take your time up with answering now. So in the interest of time, we might need to address some of these with a written response at the end of the program.
Well, or I don't mind going a little bit over. I would like to get through some of these slides, because I've done several of these webinars already, and inevitably I end up answering a lot of questions as we go along.
Okay.
I don't mind staying on the line for an extra 10 or 15 minutes. For the people, I know Goering Center, you start on time, you end on time. For the people that want to end on time, you're welcome to drop off at any point. But for the folks that want to stay on for an extra 15 minutes and we can hit some of these questions, that'd be probably ideal.
Okay, so we'll do them at the end.
Yep. Okay, so who is a covered employee? So we've talked about this already. Anyone that is working for your company is going to be a covered for paid sick leave. But for the family medical leave, you have to have been employed at least 30 days. So that means that someone who is not eligible on day one might be covered later. So keep that in mind. Just because you're not eligible today doesn't mean you will never be eligible. This also includes temporary employees and joint employees. So if you got a contract with a temp agency, those joint employees will be covered. Okay, new DOL guidance just came out over the weekend. Why? Because the DOL likes to sneak that stuff in and ruin our weekends, right? So, and to their credit, the Department of Labor has really turned stuff around very quickly. You won't find me complimenting government agencies very often. They have really turned stuff quickly on this. They've answered a whole lot of questions. Over the weekend, they cranked out 25 pages worth of guidance. I didn't necessarily like all of the answers, but I was appreciative of the fact that now we have some answers. Okay, so let's go through some of the questions that the Department of Labor answered over the weekend that are going to hit most of you based just on some of the input that I've gotten from clients. And these are a lot of questions that folks had last week, and I and every other employment lawyer in the country had to say, I don't know, we're waiting for advice from the Department of Labor. I don't know, we'll find out. So now, whatever lawyer you're working with should have some answers. So one of the questions is, how much combined FMLA and emergency FMLA does someone get? And the answer to that is, you get a total of 12 weeks in a 12-month period. So if you had someone that was off for 6 weeks due to knee surgery in January and February, those people only get an additional 6 weeks of job-protected FMLA leave under this scenario. So those folks effectively lost out on 6 weeks of paid leave, but that's fair. Otherwise, you're going to have your employees on job-protected FMLA for almost half the year, and that's not good for your company. Okay, so the next one is, what about intermittent leave? Can you do that? And the answer to that is, it depends. And that's just not just the lawyer saying it depends. Actually, the Department of Labor's answer to this was, it depends. So in this case, it depends on whether or not the employee is able to telework. So if they are able to work from home, then perhaps they're not even covered by any of this, because if they can work from home and they can do their job effectively 100% at home, then they don't need paid sick leave. So they're not covered. But let's say that they are working from home, and because they have a child at home or because they're sick, they're only able to do half of their job at home. Then you can allow intermittent leave for the employee, and so it would be 50% of their regular pay and 50% of the paid sick leave, which could be 100% or could be at the 2/3. Then the next question is, what if they can't work from home? What if you work at a factory or you work at a pizza company? Then in that instance, you can't do your job from home, right? You can't make pizzas from home. So in that instance, if the question of intermittent leave depends on what is the reason for their need for leave. If it is because they have the coronavirus, then no, you can't do intermittent leave, because you can't work a half a day at the pizza place while you've got coronavirus. So there is no intermittent leave unless it's for telework if you are in fact ill. But if your need for leave is because you have childcare issues, then you could do intermittent leave, right? So maybe it's somebody that works a half a day and their spouse works the other half of the day. Or maybe they work a different shift or something like that. You can, the Department of Labor said you can do that. The next thing, what about if someone is furloughed or laid off? Are they eligible for any of this leave? And the answer is no, they are not. They are not eligible. So, because either you have work available or not. And if there's no work available, then there's no pay, and so there's no sick leave. Also, there's no FMLA. If you lay off someone who is on FMLA or on sick leave, one, be careful. You don't want to be accused of discriminating against those folks. But two, it is clear that their paid sick leave and expanded FMLA ends the minute that the furlough begins. What about if they're a non-essential employee? So Governor DeWine has said, you know, okay, your business cannot continue. Well, if that's the case, if your business cannot operate, then they're not eligible because there's no work for them to do. Okay, let's go on to the next one here. Okay, can you supplement paid sick leave with other types of leave? And the same question goes to the FMLA. The answer to that is yes. So if an employee falls into one of those categories that only gets 2/3 of their pay, they have the option to supplement with existing company-provided sick leave, vacation leave, PTO, whatever you want to call it. That is the employee's option. You will not get the tax credit. You will not get the tax credit for that supplemental leave. So you're only going to get the tax credit for the 2/3, but the employee can still burn through the rest of their PTO. So this is one of my favorites. What documentation is needed to support leave and tax credits? So the Department of Labor decided to do us all a favor and say, well, we're not going to answer that. You need to follow IRS guidance and do whatever documentation the IRS says you need. Well, guess what? The IRS has not put out guidance yet on that. So we don't know what you need. It'd be really nice if that came out today, wouldn't it? Because, you know, what with it all going in place tomorrow. Sorry. Okay, so what documentation do you need? Well, I'd ask for a doctor's note. I would ask for whatever documentation you would typically ask for someone that is sick. But you're going to have to be reasonable and recognize that maybe they can't get to the doctor. You know, you're certainly not going to send them to a hospital in order to get the documentation. Let's be creative. If there's a school closure and that's the reason, have them send a copy of the note from the principal that says, you know, all about the great internet learning that the school is doing now. Something that just says the school's closed. Have them go to the school's website. The website probably says we are temporarily closed. Keep all of that in mind. Okay, the last question that we've got here is, who is a son or daughter under the expanded family medical leave law? The initial law, when it first came out, just said son or daughter, and it was not clear whether that was going to be an expanded definition. The Department of Labor came out and changed things to use the standard Family Medical Leave Act definition of son or daughter. That includes adoptive sons and daughters. That includes foster parents. Most importantly for all of you, it also includes what's called in loco parentis, which is it's going to cover grandparents that are the primary caregiver of their grandchildren. So we've already had some questions that have come up about that for some of our clients. Okay, we're going to fly through some of these last slides quickly and then get to Tina's part of the presentation. Don't forget the foundational skills that you've always used, okay? We've got a lot of super smart people on the line. We've got business owners, we've got HR professionals, and don't forget some of the basics. Like, make sure you're not discriminating against people as you are making your furlough and layoff decisions. So what do I mean by that? You still have to do the adverse impact analysis. You can't just say, okay, I'm going to lay off 20 people. I can't stand these 20 people, so therefore they're out. You can't do that. You've got to make sure that you're not discriminating against one group or another. Okay, flip another side to this. A lot of people want to say, hey, everybody watch out because Tom has coronavirus. And so, you should stay away from Tom. They want to disclose. They say, oh, well, we have an obligation to disclose. Well, you also have an obligation to follow the law. And the law is very clear that you should not talk about someone's medical condition. Okay? You would never, ever say, hey, Mary's got breast cancer, or Tom's got prostate cancer. You would never disclose someone's medical condition under different circumstances. You would never say, hey, this person has AIDS. Okay? Don't forget those basic rules. There's a lot of, hysteria is probably not the right word for it, but there are a lot of people going around saying, oh my goodness, we've got to do this. No, you're going to get sued. You are going to get sued, and the lawsuits are going to start being filed. They're going to start coming in, I would guess about 2 weeks is when we're going to start seeing lawsuits over the paid sick leave and over people whose medical conditions have been disclosed. So remember, as you're going through this, again, talk to employment counsel, get that privilege protected advice to make sure that you are not disclosing things you shouldn't disclose. Okay, and on the furloughs and layoffs, make sure you're doing that carefully. Okay, notices. If you haven't posted your notice, get it up today. It's got to be posted in the same spot that you put all your other posters. Go to the DOL's website and post that and print it and just tape it to the wall, just like you do everything else. Doesn't need to be laminated, doesn't need to be fancy. If you've got remote workers, you should email it to those workers. If you don't know how to get to the poster, if you go to Graydon.law, go to the COVID website. Christina Rogers wrote a post on that on the 24th of March, I believe, about posting notices. And so for that purpose, check on that. Lisa, I can see you're texting me something.
No, I'm not. I was texting Tina, sorry.
Oh, okay, no problem. Okay, so small business exceptions, we've talked a little bit about that already. It will apply to some small businesses under 50 employees. Primarily, the exemption is going to be for the people that need the child care leave, not for the folks that are sick themselves. Okay, tax credits. There is the pay tax credit. It is a pass-through. Talk to your tax advisor to make sure that you are handling that properly. There are all kinds of debits and credits. My dad's an accountant. I don't know if he's on the line this time. He listened last week, and he and I talked over the weekend, and he was telling me what a nightmare it is to move everything from one column to the other, and ultimately it's a wash, but boy, it's a pain in the backside. That reminds me why I went into law and not accounting, right? Because I don't need to worry about that stuff. The CARES Act, if you're not up to speed on that, you should also be talking to an attorney about that. There are a lot of great loans and other opportunities for businesses out there. We're not going to get into that here because this is focused more on the employment side. There is enhanced unemployment coverage and incentives to companies who reduce hours but not headcount. So before you do a layoff, make sure that you're looking at all of the options. The CARES Act is about 3 days old. And so, everything is moving quickly. It's bizarre. Some of this feels like it's a long time off, but it really isn't. Okay, layoffs and furloughs, make sure that you're careful with the way that you treat your exempt and your non-exempt employees. Non-exempt employees only get paid for hours worked, but exempt employees are entitled to pay if they do any work in a pay period. So you can't do the whole wink, wink, I'm only going to have you work from home, but I'm still expecting you to check your email. Can't do that. If they're furloughed and they cannot be working. Otherwise, you're going to have to pay them. And these folks are going to come back and they will, and maybe not your employees. Everybody says it won't happen to me. But they're going to come back, they're going to file lawsuits, and the Fair Labor Standards Act has multiplier provisions in it. It also has attorney fees provisions in it. And as you might guess, the attorney fees provisions only flow one way, just like under the Family Medical Leave Act. So the plaintiff recovers their attorney fees if they win, but you can't recover yours. If you reduce the pay of your salaried exempt employees, you need to do that very carefully and work with experienced employment counsel on that as well. And with that, I am finished with my part of the presentation. There are a whole lot more slides that that we will send out that are from previous seminars that I have done that kind of summarize some other points that I figured I would just leave in there in case folks want to see them.
Great, thank you, Lee. There are a whole lot of questions for you on that, and some of those things you covered after the questions came through. So while we turn it over to Tina, maybe I could go and take a look at the chat, and at the end of Tina's segment, we'll open it back up and you'll be ready to roll responding to those questions that make sense to respond to, okay?
Okay, that sounds great, thank you.
Okay, great. So hi, Tina, welcome. How are you? You've been busy, haven't you? Tina, make sure you're unmuted. All right. So everybody, you might have noticed that some of our folks had trouble hearing in the beginning, and Tina was one of those people. So she just dialed in, and we couldn't test it in a live environment which number she was calling in from. So she's struggling with her sound right now. Give me just a second. Tina, are you calling? Nod your head, yes or no. Are you calling from your number 313-0501? I don't know what you just said. Tina, can you hear me? Text me, Tina, your phone number that you're dialed in on. Thanks, everyone, for your patience. 303? Okay. I got to find that in a long list of numbers, so just bear with me. Oh, just saw it. Okay, Lee, while we're figuring this out, do you want to go ahead and tackle a couple of those questions while I get Tina unmuted? Now, Lee's.
Yeah, I was muted. I'm sorry. I'm trying to. Okay, we've already answered that one. What was the first of the 6 reasons? The first of the 6 reasons is that the employee is subject to a federal, state, or local quarantine or isolation order related to COVID-19. What about a grandparent taking care of a grandson when school is closed? It depends on whether the grandparent is in loco parentis. So is the grandparent really someone that is in charge of this kid, or is the grandparent just a babysitter? And in most cases, the grandparent is just the babysitter and not someone that is really responsible for the day-to-day. They don't have custody of the child. They're just helping out mom and dad, and that's great, but they're not going to be entitled to the protections of the paid sick leave or the other law. It's just like when grandma and grandpa want to take off work any other time to help take care of the kid. Let's see here. Must an employee use some or all of their company PTO before receiving the paid leave? The answer to that is no. You do not have to use the PTO. This paid sick leave comes first. And after the paid sick leave is expired, then they could use their PTO or vacation time. And in some instances, they can supplement their paid sick leave or the FMLA when they're only being paid at the 2/3 rate. They can supplement with their accrued PTO. Okay, what happens if a person is quarantined by governor recommendation and the 2-week period ends April 3rd? So what I guess the question is it really was it really a quarantine? And if it really was a quarantine, so I'm not talking about the stuff that Governor DeWine has ordered. I'm talking about a true, you just got off the cruise ship and somebody's ordered you in a quarantine. If that's the case, they're only going to be entitled to 3 days of the paid sick leave under the law. That would be April 1st, 2nd, and 3rd. The previous time, if you pay them, then it was gratuitous. Thank you very much. You're a great company, but it is not. It's not going to be protected under the law, and you're not going to get the tax credit for it.
Okay, I think we have Tina back. Let's see if we can hear her.
Can you hear me okay?
Yes, we can. Thank you, Tina. Go ahead and turn your webcam on.
Oh,
Lee, if you want to figure out that.
That's a cruel twist of fate, though, if they have to see me, but they couldn't see her.
Oh, there you go. Sorry, everybody. We have a lot of people on this call. I think we're testing the system.
Mm-hmm.
So, Tina, you've had a rough couple of weeks. You've been doing a great job servicing all your clients, and I know that you have a lot of information to share about what they're experiencing. So why don't you just kind of frame it up for us, what you've been hearing from your people?
So as Lee said, it's challenging times. You know, we're dealing with new laws that there are a lot of unanswered questions, and the Department of Labor continues to release answers, which we're still having to decipher and kind of guide our clients. I know Lee has reviewed all of those, which is fantastic. There are still, as you can see, so many more questions. And what I really wanted to talk about is how the world's going to change going forward, and being more proactive. You know, we can deal with, you know, trying to decipher how this works, but the reality is the world as we know it is going to change. The work environment, how we interact with our employees. This, even though we think this might be a temporary situation, this is something that could be really changing the whole landscape of working remotely and utilizing technology. And what are the tools and resources that are out there and are available, not just from a high-level company standpoint, but also as managers and as employees. And so, so that's something I always ask everyone to take a look at. Don't think of this as a short term, but maybe this is changing how we operate business, maybe less face-to-face meetings. And along that lines, you know, I work with a lot of small businesses, and a lot of them don't have the technology to even communicate with their employees. So you think about it from a leader standpoint. If you're a CEO of an organization, how do you communicate during these times with your employees if you don't have, you know, a common email system, or you don't have a mobile app or an HRIS system that lets you communicate messages to those employees? So the worst thing that can happen to an organization is gossip and rumors. You need to be able to take control over it, lead it, manage the conversation about what's going on in the organization, whether or not you're an essential business or not. If you're a non-essential business, then maybe you have a lot of people working remote, or maybe they're not working at all. You've laid them off or furloughed them, making sure that you're keeping them engaged, you're having ongoing conversations. They know you, you still care about them. How you treat your employees during this time is going to speak volumes, and employees are going to take notice. And it's going to make a difference in 6 months or a year when the economy's back, whenever that is, whether or not they stay engaged with you, they want to be on the team, or they're disappointed in how the situation was handled. So I like to say, you know, keep that in mind. Make sure that you are being proactive and communicating initiatives. And also, you know, if you are an essential business and you're still communicating, pull together an emergency team so that if there is an incident where someone has it, or a family member of one of your employees has the virus, that you know what the plan is going to be. And you're involving all the different business units, making sure that you're pre-communicating to your employees, because they're nervous and they're scared. They're thinking, you know, so-and-so's out still meeting people at parks or wherever it might be, they're still interacting. So what is the plan of action if something does happen? It never hurts to pre-communicate that.
Yeah, that lends to, excuse me, the topic of exposure and the things that can be going on without an employer's notice that they have to deal with once everybody is back to work. Why don't you talk a little bit about that for us?
I'm sorry about what you were cutting out a little.
Oh, I'm sorry. A little bit about the exposure that can kind of creep up as the workforce is out living their life while everybody's supposed to be working remotely. Subjects like drug testing. I mean, can you touch on that for us?
Absolutely. So the one thing I say, it's not only having a pre-communication plan or plan of action when something happens, but also take this time to review your policies and your procedures. So for instance, we've had a lot of clients ask us if we've laid off our entire workforce, we think that they might be enjoying themselves a little too much during this time with friends. Do we have the right to re-drug test them when they come back to work? What does your policy say about that? Are you reimbursing employees? That's another thing that we're hearing a lot of questions. Should I be billing back my employer for getting an advanced internet streaming service? My phone bill usage. I'm hearing from technology firms that they are on backlog of ordering laptops and computer equipment, but also phones. Do you want to provide company paid phones to some of those employees? So there are a lot of different policies and procedures that you might want to take a look at, and this might be the time to either revise them and or draft them. But I think with a lot of the changes that Lee reviewed, I think we're going to see a lot of changes in how we treat people going forward from a sick leave standpoint. So that's to be determined.
And I would just also add that you also have to budget for those new communication tools. We had to stand up this webinar platform in a matter of days, and there's costs associated with that. Wasn't in the budget this year. So you just have to be prepared for that and thoughtful about it. Tina, do you have any recommendations on the basics in terms of what an employer should have in terms of being able to communicate with their client or employees? You mentioned that you're shocked to learn that some employers don't even have email addresses or cell phone numbers for their employees.
Absolutely. So, communication, like trying to pull that together, I know can be difficult during these times, but if you haven't leave the people off or they're still working with you, try to gather that as soon as possible. Try to look for some HRIS systems that can help you house that, but also communicate going forward. The other piece of advice I'd say is this is a great time for managers to step up and communicate with their employees. And it's not just, it's generic. It's more of that personal touch, reaching out to your employees, maybe scheduling one-on-ones, helping them understand, what they are being held accountable to do in order to make this work. They might not be able to complete every essential function of their job, but what can they do remote? How can you support them? How can you help them through this time? It's high stress, high anxiety. Do you have an employee assistance program that you can offer them to help them cope? How are they balancing, pets and their family members being at home? I know that there are a lot of interesting tips online that you can see, and we've seen a lot of fun stories over this time. So trying to have those conversations about how you can help them during this time, I think is really important. But also as a manager, just making sure that you're keeping them engaged, you're keeping the morale up, you're letting them know that you're there for them to talk to. But we've been saying this for years, performance. When it comes to performance, it's not a conversation that you should have once a year. It should be something that you have with a good cadence and on a schedule. And this is a good time to book that one-on-one conversation with each of your direct reports. Put it on the calendar so they're prepared. And, it depends on the nature of the business and the employee, how frequently that is.
Thank you, Tina.
Welcome.
So the questions are continuing to roll in, and I haven't been able to watch this closely, but I'm sure that there are a few for Tina in here as well, so I'll look for those. But right now, I think this one is probably best for Lee, but Tina, chime in if you want to weigh in. Mike Geiger would appreciate more information on the temporary labor comment you made. If we have 3 temporary workers, does the leave get paid through the company or the temp agency? They are not on our company pay normally.
Who's that question from?
Is that your dad? His name's Mike Geiger. Is he trying to help you?
Yeah, that's a plant. Goodness gracious. And he threw me a curveball too. So the temporary employee provisions that are in there are, you do have to provide the leave. You'll need to coordinate with the temp agency that you're working with. And Dad, give me a call later and we'll talk it through, but it's more than we want to cover, can cover on this. So Lisa, what I did while Tina was talking was go through the list of questions. Do you want me to try to do rapid fire?
I think that's great.
Quick responses?
Yes, please.
All right. So let's see. One of the first questions is, what do we do about non-scheduled employees who are on call? And there are formulas in the expanded family medical leave and the paid sick leave for how to deal with employees that work less than a full-time schedule. It is a complex formula that you look back over a certain period of time and figure out what was the average number of hours that the person worked. So you'll need to actually get those formulas out of the law itself to figure out what is the right way to go about that. We've got another question about, what if my employees are working from home and they're only able to do part of their job from home? Do we have to pay them? And the answer to that is, well, it depends. It depends on whether or not they're salaried exempt. It depends on what's the reason that they can't do all of their job. This might be an opportunity for you to use intermittent leave. And intermittent leave is at the employer's choice, not at the employee's choice. It might be a situation where you would reduce the person's salary or wages for a period of time. You've got lots of different options. Our clients are getting very creative about ways to keep people employed, but still save costs on payroll, and to the extent possible, move some of those costs into the pay provisions here. Let's see. For a question about, if we have more than 500 employees, do we have to put up the poster? Thank you for the easy one on that one, and the answer is no. If you have more than 500 employees, you do not need to put up the poster. Do temporary employees have paid sick leave rights? Yes, they do. It is clear under the law that those folks are going to be, you're going to be considered a joint employer with the temp agency that you're working through, or if you've just hired some folks and said, okay, this is a 30-day job, yeah, those people are still going to have the rights. Another question about what if an employee wants leave to take care of their parents? They say that the parents aren't sick, the employee's not sick, but the parents fall into the elderly classification, they're in a high-risk group, or maybe the employee is in a high-risk group, but it's all precautionary. The answer to that is it is not going to be covered, at least not as things are right now, because they're not able to check the box on one of those 6 things in the chart that would be covered. Someone that just voluntarily takes leave does not get paid sick leave. That you can allow them to use vacation pay or other sick pay that the company has, but they're not going to be entitled to pay under these laws. Let's see. Someone asked, what's the form title that you need to post? To be honest with you, I don't know what the title of the form is, but you need the non-federal version. There are 2 versions, one for federal employees, and I'm assuming that because it's the Goering Center here, we don't have any federal employers that are on the call. So you need the non-federal form. It should be on the Department of Labor's website, which is dol.gov, or again, you can go to graydon.law and look for the blog post written by Christina Rogers on March 24th. She writes, she's an awesome writer, and a lot of our blogs are written in plain English because I don't like to read lawyer speak and legalese, and I don't like to write in legalese, and neither do my colleagues. So we try to write in human. I've got 2 more here. Someone asked a question about the 10-day gap. Yeah, back up one more previous. So the very top one, the COVID-19 resources, you'll be able to find everything there. But the next one down has a great chart. The employer's action items for today is a great a great chart for you. Summary of the new DOL guidance is the stuff that came out this weekend. That's the post called New Week, New Rules. What employers need to know today. That's one that I wrote yesterday. And the last one has the notice. That's the article that Christina Rogers wrote. So the last two questions. One was, what do we do with the 10-day gap between paid sick leave and family medical leave? And the answer is those two laws go hand in hand. There is no 10-day gap when it relates to childcare, because the first, you'll start the clock on both at the same time. The paid sick leave starts right away and covers the first 10 days, and then the family medical leave starts on day 11. So those two laws work together. There is no gap for employees. And the last question, what if an employee wants to take off work and be home with their kids through all this? Nobody's got anything. They just want to use their vacation days. And the answer is go ahead and let them use their vacation days. But you don't have to. If you're an essential business and you need people at work, you don't have to grant all of this this time off for employees that don't have any, don't check the box on one of those 6 conditions. All right, that's as far down the list as I made it, Lisa. So
there are a lot of, probably about 12 more questions that have come in since you started taking over. Some of them touch on topics that you've covered throughout. So I'm going to suggest that we wrap it up here. And I'm going to go back to the slide that shows Tina and Lee's contact information. And as I shared earlier, we'll be sending the slide deck out to everybody that's been on the call, and it is recorded. So you can get in touch with them directly. They both agreed to welcome your calls and email. And I think you will find that in the appendix attached to this presentation, there's a lot of additional information that you could find very helpful as well.
Can I chime in
Sure.
on one more thing, Lisa, that I just forgot about? If you are allowing your employees to work from home, there is a slide on here that has some really weird language that says that they're not able to perform the essential functions of their job. Please make sure that you send that in some form or another to your employees who are working from home. That is not at all to protect you today. That's to protect you in 6 months and a year when employees decide that they want to work from home and as an accommodation for a disability, and you're not able to accommodate that. So sorry about that.
Oh, that's okay. Thank you. Tina, do you have any concluding comments? Anything you want to wrap up with?
I just say this is, very interesting times. We're trying to interpret the laws, but then I think when everything settles down in the next week or two, I think we're going to be really looking at how we interact with our employees going forward, and communicating and doing training and trying to provide them tools. The one other thing that I'd like to say is, we've talked about the multi-generation workforce being out there, and right now might be a good time for us to leverage maybe some of the younger generation that's more technologically savvy to interact and help others that are less so. I know we're seeing a lot of employees, and it doesn't matter their age, generation, but some people are more than others, and this is a good time to bring people together and help.
Yeah, a little bit of reverse mentoring. Okay, well, thank you, Lee. Thank you, Tina. We greatly appreciate you volunteering your time today on behalf of the Goering Center Learning community. Everybody on the call, if you're interested in additional topics as you work through the next month or potentially longer, we have a call tomorrow, a webcast tomorrow at the same time, 10 a.m. with Diane Egbers of Leadership Acceleration on how to lead in times of rapid change. And on Thursday, we will have a webcast with Pam Beek of Salesforce and Amy Connor of CMO on Load. And they're going to be talking about how you balance compassion with the need to get results while your team is working remotely, specifically in the context of your sales force. Delicate and challenging time for anyone in sales, and but still, as business owners, we all need to be mindful of those issues. So thank you all today. I appreciate your time, and we're going to say goodbye. Have a great day. Take care. Bye-bye.